Hello, guys. Hope you're all good. Today, let's discuss what are the options left out with a freshly passed out MDS individual. Uh, they are majorly left with three to four options. Primarily, option number one is joining the academics, and wherein like your level increases every 3 to 5 years based upon the vacancy demand. And it starts off with senior lecturer and then again proceeds to reader, followed by professor, and finally the head of the department. This all comes under academics. And option number two is starting freelancing, and that is your consultations. This is the most common viable option opted by most of the freshly passed out, especially when it comes to clinically oriented departments, right from your endo to oral surgery, prostho, orthodontics. Option number three is starting off your own private practice, that is your own clinic, and this again varies. The clinic costings, that is your capital investment, might vary right from 15 to 18 lakhs for a basic setup to even 35-40 lakhs for a more premium setup. Okay, so based on their own capacity, people invest, and then when they do, then again comes another struggle, and that is your clinical struggle, that is getting your patients, coming to digital marketing, getting your first year of patients in the starting 3 years followed on. So these are the options, and yes, of course, the final option is going for any government jobs and any vacancy in supposedly army dental college and so on. So the most commonly opted scenario is any freshly passed out supposedly primarily opts for consultants, as it is more easier to infiltrate over here and further grow your practice. But then again, this is not your private practice. You're a consultant, you're a specialist going to that place, working for them, and eventually, how much do you earn as a consultant? Supposedly, a freshly passed out MDS has started doing freelancing, and which is the most commonly opted field. So when it comes to clinical oriented departments, uh, and supposedly they are doing full-time consultants, so their pay might vary right from 1 lakh to 1.5, sometimes even 2. So 1 to 2 is notion, but uh, you can take 1.3 to 1.5, but again they're doing it as a full-time job. When I mean full-time, I mean roughly 9 to 10 hours a day, 6 days a week. So then what happens is they, after doing their savings for roughly a matter of 2 to 4 years, sometimes even 5, they again invest into clinics, then again the clinical struggle, and so on and so forth. So this is usually the life cycle of a freshly passed out MDS graduate.